has become since the coup of the 1st of February 2021. My name is Michael Marrett-Crosby. I'm the Chief Executive of the Sue Foundation and of other charities that are operating in and with the people of Myanmar at this time. We are joined from across the world by friends, experts, people who are working on the front line to bring relief to the people of Myanmar. We've had some changes to the program enforced on us by some of the different circumstances in which we all find ourselves at these complicated times. I'm conscious that we're joined by listeners and viewers across the world. It is a privilege that you are able to join us either live or after this event on YouTube. In our program, we have an opening statement. I'm just going to check with our organizer whether the opening statement is happening. Yes? So we will begin by inviting His Excellency Pier Ferdinando Cassini to say a few words. I don't think he will need too much introduction to most of you present in the room. Senator, former President of the Chamber of Deputies. I invite him to make the opening statement. Perhaps we should move on if he's late. Yeah. We will have an opportunity to hear from the Senator later in the proceedings. We're going to now listen to a witness who has been working on the front line of healthcare in Myanmar. It's my privilege to be able to introduce you to Dr. Nay Lin Tun, who has been working in both Yangon and in Rakhine as a public health specialist and as a frontline doctor in Sittwe General Hospital and then in Yangon. Dr. Nay Lin Tun is going to describe to us the reality of the COVID pandemic in Myanmar. Dr. Nay Lin Tun, you have 7 minutes. Please start.
Good afternoon, ladies and gentlemen. I am Dr. Nay Lin Tun, Myanmar. I would like to share my free experience when I was working as the frontline medical doctor in Myanmar. Myanmar is in crisis because of the 2 main root causes, COVID-19 and military coup. In relating with COVID-19, we faced first and second wave outbreak in 2020. As the main challenges, most of the community have lack of knowledge about COVID-19 because they have never heard about this pandemic before. That's why we are trying to promote health awareness. At the time, I was working in Rakhine, especially focusing on marginalized community, such as Rohingya and internally displaced populations. At that time, they didn't have any information about COVID-19. We provide health education talks and distribute face masks. These are the photos from my free walk. We set up hand washing basin in every village. In the second wave outbreak has been in the Rakhine state, and I contribute as a volunteer medical doctor in Sittwe General Hospital. Under the support of National League for Democracy government, we could control the outbreak and start COVID-19 vaccination program in early 2021, as taught the country in Southeast Asia in getting COVID vaccine. But all this good work started at 1st of February by military coup. People don't accept the military coup, and they are still protesting around the country. Military gender use strong forces in crack down the protests by using explosive weapons and real bullets. It caused the serious injuries and deaths of the civilians. These are the photos of my hometown. It's very sad to see my hometown is burned like a battlefield. As a medical practitioners, we are trying to provide medical assistance to the injured patients. But the security forces target the healthcare workers. They try to attack and arrest and torture the volunteers. However, we always stay standby near the protest area and assist the injured patients. We have witnessed lots of violence crackdown on civilians by the military. These are the photos from my frontline work. Even the young children are the target of the militaries. We also try to reach out international humanitarian organizations to support immediate assistance for the people who are suffering on the ground. But they also have limitations and cannot go to the front line. That's why our healthcare workers are taking risk of our life and save the life of the patient on the front line. We train general community about the first aid because we understand that most of the cause of death are caused by delayed arrival to the hospital and uncontrolled bleeding. Myanmar people were unlucky. We faced COVID third wave outbreak in the middle of the coup. Under military region, thousands of people died with no access to hospital, no oxygen, no drugs, no enough medical doctors nearby. We try to support the COVID patients by home visit and hotline telephone consultations. Many medical doctors got infected with COVID-19, including me. Some senior doctors could not overcome the virus. We collect donations and provide oxygen concentrators and cylinders to the patients. At the time, the price of concentrators and cylinders was so high, and most of the people could not afford to buy it. Military gender also blocked the oxygen supply. People had to scramble the news every day to find which place have oxygen available, and they had to wait 1 to 2 days to get oxygen. Thousands of people dying without getting oxygen. In addition, military gender also attack and arrest the healthcare workers who are having the COVID patients. Not only the COVID patients, but also other emergency cases like child delivery. They could not admit to the government hospital. There are some reported cases of mother and child death at that time. When the COVID third wave declined, the military general started crackdown again. But at this time, it's a widespread violence on the community. According to the collected data, over 1,000 people has been killed by the military. In fact, the violence and crackdown on the protests in Myanmar is very bad. Over 60% of demonstrators given by the state actors around the world by this year has been in Myanmar. Over 200,000 people have been displaced from their houses, and this number increased day by day. It shows that the urgent need of humanitarian assistance in Myanmar. Over 20 cities has been cut from internet and telephone communication. It brings a big challenges for the healthcare service and entirely treatment on the patients. These are the photos when we are providing a training, basic surgical skill training on the frontline medics in one remote area of the country. We are trying our best to support the patients and to give life. But our senior brothers, our junior brothers has been killed, arrested, and tortured by the military. I would like to end this presentation and by thanking for this wonderful opportunity. Our people deserve freedom and human rights. Without the help of international community, we are not able to achieve it. We would like to implore and urge all of you to use your position of power in supporting our fight for democracy by recognizing our national unity government and protect our citizens. Thank you so much for your kind attention.
Dr. Nailin Tun, thank you for the